Hey, I'm Dr. Jill Weiner. I'm a board certified internal medicine specialist, meditation teacher, EFT tapping practitioner, anti-racism educator. And I want to talk to you today about different ways that tapping can be applied in trauma spaces. You may not know that one of the ways that EFT tapping, EFT is the emotional freedom technique, or otherwise called EFT. It's also called tapping. It originally was studied in trauma spaces. I first learned about it from a psychiatrist and a psychologist who were using tapping on their PTSD patients at the VA. So I want to talk to you about a couple different things. First off, how can you use EFT tapping for trauma in trauma spaces? And then also, how can you lead tapping in a trauma-informed way? So in terms of how we're going to use EFT tapping in the trauma space. So one of the main ways we can do that is with healing trauma. You can help people process a recent traumatic event or a historical traumatic event. And this really requires one-on-one work with a skilled, trained tapping practitioner. This isn't something that I recommend that you do on your own, that anyone do on their own, or anyone do with tapping videos or anything like that, because a lot can come up and there's very specific techniques on how to do this in a safe way. So there's specific techniques that are used to help people process a specific memory, which can, when that memory is processed, it can then downstream no longer have any or as much impact on the person's thought process and behavior and life moving forward. So almost like if you have a suitcase that's packed really nicely when you go on your trip and everything's nice and folded in there, and then on your way home, you still have all the same stuff, but you've got a bunch of laundry and that's not folded nicely and you can't get the suitcase closed, and there's like pants and shirts sticking out the side of the suitcase and it's a lot harder to close it. One of the ways to think about how tapping can be used to heal trauma as we go through a specific traumatic memory is that allows us to, in our memory, kind of fold the memory more nicely and neatly so that it's no longer having that impact on the way our nervous system processes and remembers that event. Also, in trauma spaces, tapping can be used for self-regulation, so to take care of my own emotions, and co-regulation to help other people take care of their emotions. So kind of when someone's feeling really activated or really triggered, tapping can be really great to help calm the nervous system. That's part of how it works. It changes the way the stress center of our brain processes stress. Tapping can also be used to process strong emotions. So there might be anger towards someone who harmed you, or anything else beyond just being activated. There might be a strong emotion that comes up around something that has happened. That can also, tapping can also really help. Also, doing trauma work in general is very difficult for trauma practitioners, and tapping can be used to help trauma practitioners regulate their own emotions, process some of the stuff that's come up as they hold space for other people who have trauma. And then finally, tapping can help people stay in their body when they're too activated to tap on their emotions. So sometimes tapping on a really intense emotion or a physical, or a traumatic memory, it can feel too overwhelming. Like going back into it just makes the stress and the overwhelm worse. So what you can do is, instead of tapping on the emotions or on the memory, you can actually tap on how that is feeling in your body. So maybe there's a constricting in the chest, or there's a tightening in the shoulders, or a knot in someone's stomach, or their heart is pounding. Whatever that is, you can actually tap just on the physical sensations, keeping you in the body. That can help to regulate the emotions, because the mind and the body are connected.